most of them when I came in, they said they usually get better classes.
So tomorrow I gotta go to water. Yes, 3 hours.
I'll just do that in the future, because I usually.
So the brown pickup is in the shop. I'm gonna be taking the
I have to.
I'm just real early today, so.
I can get you a couple of things, maybe not be too much below that.
You know, as much chicken scratch as you get.
Well, we'll go down there.
Yeah, it's pretty.
What you do?
Crack one.
Between you and your brain. I'm just the secretary. You might be the big decisions.
So, because I was on that waters task force, now that we have water quality control, it's the new legislation.
That's for my chickens. And that's not. They start about. They start.
And you are going to record, right?
Yeah,
And you are using the county Zoom on that?
yes.
Okay, the only reason I'm asking is because then that automatically says
That's
the,
next year.
using that otter,
Yeah.
and so it.
So there's no Zoom option, this is in person for an hour.
Yeah, so I have it set up on the same Zoom account so that it'll drop to whatever you have.
1 minute.
Shane said this doesn't require a login, so I can just use this laptop every time.
Yeah, I thought that was the situation, but I wasn't sure how.
Yeah, we're good to go, so.
Just about ready.
Recording in progress.
Belch or something?
Or something.
1 minute is pretty long, right?
I said that this morning when I first got here, you guys were.
Yes, well, good afternoon, everyone. I want to welcome all of you to the Los Angeles County Board of County Commissioners, acting in the capacity as the Board of Human Services. Today is Tuesday, January the 16th, 2024, and it is 1 p.m. I'm going to call this meeting to order. Please rise for an invocation by Commissioner Luis Lopez, and followed by the pledge of allegiance by Commissioner Tony Haas.
Heavenly Father, we thank you for this opportunity to gather in your name today, to do the Lord's work for the Los Angeles County residents and citizens of this community. We ask you, Lord, and for protection of those citizens during these cold and difficult times, and for those less fortunate, that they are kept warm and safe during this winter season. In your heavenly name, we pray. Amen.
Pledge allegiance
To the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Roll call, Mr. Aragon.
My apologies, Commissioner. Commissioner Tony Haas,
Here.
Commissioner Luis Lopez, Commissioner Felix Lopez.
Here. And so, approval of the agenda. Do we have any changes to the agenda, Mr. Aragon?
Commissioner, the only change would be to new business item A3, Division of Youth and Family Services case count. We'll need to update at next week's meeting, so I'll just ask that we remove that item.
Okay.
Other than that, no additional changes.
Any questions, discussion, Commissioners? Otherwise, I'll entertain a motion to approve the agenda without any change.
Move for approval of the agenda without deletion for correction.
Second motion?
Commissioner Tony Haas,
Yes.
Commissioner Luis Lopez,
Yes.
Commissioner Felix Lopez.
Yes, thank you, Commissioners. Section 2, minutes for December 19, 2023. They are attached to the packet. Do you have any questions, any discussion on those? Otherwise, I will entertain a motion.
Motion to approve the minutes December 19th, 2023.
Second motion.
Commissioner Luis Lopez,
Yes.
Commissioner Tony Hass,
Yes.
Commissioner Felix Lopez.
Yes. We're going to go to section 3, Director Report. Mr. Aragon.
Good
You
afternoon,
have the floor,
Commissioners.
sir.
Thank you. So just a few updates regarding our transition with the case management agency that's coming down the pike. This is with our formerly known as single entry point program. Our team met with our CCB staff and our Warfield County subcontract staff in the Adult Aging Services last Friday. We had a collaborative team meeting regarding the upcoming transitions. I felt like it was a really good meeting. Actually, it was an opportunity for all of the staff to really voice concerns and opinions and what they'd like to see in this transition. So we did hold that meeting. We'll be moving forward with our community stakeholder meeting and client meeting. That'll be on January 31st in the evening from 3 to 5 p.m. And then we'll host a second session on February 1st from 9:30 to 11:30 a.m. to ensure that folks who can't make it to either of those times have an opportunity to attend. That meeting agenda will primarily be to discuss what transition processes are currently being conducted and what the ultimate goal of that will look like. And we want to ensure that our clients, our community stakeholders, and the agency area partners that we work with for service providing have an opportunity to have a voice in that transition process as well. So those 2 meetings will be coming. We're also looking at scheduling 2 additional sessions in Warfield County since we service both areas. And so we'll be looking at doing that sometime mid to late February. Any questions on the transition process?
Yes, one of my questions, I go through the documentation since Los Angeles County and Warfield County in a sense are pretty much one unit that delivers services. Are they going to be pretty much equally the same for both counties, services rendered to this?
Correct. In regards to case management, just a reminder to the board, what we're looking at doing is there are 10 waiver services under Medicaid that we provide long-term care to all children all the way up to adults. What this process will be doing is looking at migrating the 3 waivers that the CCB currently houses, which is the family support, SLS, and other programs that they issue through Medicaid waivers over to our department as a permanent transition. So all Medicaid waiver services will now come out of DHS through the CMA, Case Management Agency. That division of the LACRC or the SCDDS, Southern Colorado Developmental Disabilities Services Agency, will close down effectively March 1. So we'll be in transition of billing and documentation and records, and the state has provided us with timelines and guidance on how to ensure the safety of confidentiality and to ensure no HIPAA violations, how those documents will be transitioned over. At that time, both Warfield and Los Angeles, Warfield is a subcontractor of our single entry point, currently CMA now. And under that, they issue for their county services in those waivers, and we will continue to issue for Los Angeles. But we, as the primary CMA, have oversight over all of the 2 counties.
Who's going to overtake the operations of SCDS? Is that LACRS?
Yeah, so my understanding is, and Mr. Roy at LACRC and SCGDS has not really indicated what they're going to do with that portion of the business, because the case management, so it was found, if you remember some time ago, a conflict of interest occurred because you could not draw down on Medicaid as a case management agency and also be under the same umbrella to issue services out. So it's essentially double dipping as well as to the federal government. So to create a conflict-free case management process, the CMAs were put in place to transition.
Thank you, Paula. I don't think the recording can hear it. That's my saying.
No, but it was definitely a rumble in here. So,
They can't draw down on the 2.
they can't draw on Medicaid dollars for both areas. It's considered a conflict of interest. So to fix that, basically, the 3 waivers that the CCB has carried as a community center board for years now has to be encumbered under this CMA, this case management agency. And so last February, if the board will recall, I submitted a large grant application to the state in order for us to retain that program and to retain those services. And so we were awarded a letter of intent to award. And so we're in transition phase 2 right now. And so at the end of February, the intent is that we will be fully transitioned. And as of July 1, we will assume the CMA and all waiver services in our department.
So we'll be overseeing that portion of it, the
Correct.
case management of it, but not the operations of transportation.
Correct. The services will still remain with LACRC. We utilize them, COG, Caring Angels, other agencies to provide those services. We will simply be the case management agency to oversee the case. Two things. One, we work with our economic security division to find them financially eligible for long-term care. And then we also work with the CMA caseworkers to find them functionally eligible, which are two separate components to the determination process.
And for purposes of information for our constituents and taxpayers, there is not going to be any Los Angeles County dollars per se invested in a different county.
No. Essentially, what we have to do is, and if the board recalls, annually in the past, any unused portion of the single entry point funds went back to the state. The same applies in our last SEP audit. We determined that Huerfano County needed to track their funding because we pay them as a subcontractor for the services rendered. And what we look at is the number of clients they serve in each month, and there are specific portions of the contract that lay out a dollar amount associated with each of those activities. However, SEP was informed in Huerfano that should they not, as a subcontractor, utilize all that fund that we send to them, a month by month, we send on a quarterly basis, but essentially it's a month by month payment, that any unused portion has to come back to us, because essentially at the end of the contract, we will have to refund that money to the state Medicaid program because it's unutilized funding. So it is in a deferred revenue stream, and so they are tracking. We get a quarterly report from Huerfano to assure that we're monitoring how much money they're actually utilizing towards
Or
that
that
program.
restricted fund program.
Correct.
So, having, or let me ask this question, does Huerfano County have a director in place at this point?
Yes, that's my understanding. I met with her.
So all the paperwork, anything on our end, we be responsible for this new case management, which you just described a few minutes ago, all in place?
Yes.
And
Yes.
all the.
So our existing MOU with single entry point in Huerfano County is in effect until June 30th of this year. Once we transition to the CMA, that won't change anything, but we'll issue a new MOU, which we do annually with them. So that'll go into place. We did issue that out to them for signature back in May of last year. We did have to encumber because we did not get a response from Huerfano until late in September that it was signed. And so we now have that contract in place, but we withheld the first quarter payment for the new fiscal year because we did not have that MOU in place. Once that was signed on both ends, then we issued the first payment for this fiscal year. We won't issue a payment unless we know that we have a signed MOU in place with the subcontractor.
So is there going to be a cap or a fixed amount allocated by county? And in the event that you underspend on it, you know that you're going to, it'll come back through the Senate, or be sent back up to Denver.
Yes.
And, but on the opposite effect would be if there are not enough funds appropriated, even though it's going to be year one kind of a new concept, is there going to be an opportunity to drop down additional dollars?
Yeah, so essentially what we look at is that month-to-month activity. We get a report from the state on both the expenditures and the revenues. They come separately. Lori's here. Essentially what we look at is the activity by county. So the data we get does in fact indicate by county the number of clients served in that area. So we can track down to the penny how much we're drawing down within each county. And so if we see that, for instance, Huerfano County, who has substantially been underspent, just as we are, we're pretty frugal with this program, but essentially there's a balance that exists on the Huerfano side that should they need to utilize those within the year, they can, as long as it's encumbered for single entry point or the new CMA, as they call it, funding. At the end of the fiscal year, any unused portion would come back. If there were an over expenditure, because again, this is 100%, it's not a local county tax dollar match, then as the set agency, we would look at if there were any over expenditures in Huerfano as a reserve fund here that we have, we can cover that cost so that we don't end up utilizing any local tax dollars.
Tell me again where that single point leftover money is going, into the reserve?
But we have a separate line item on the budget and on the books that it's a deferred revenue. And so all that money is tracked independently into that reserve fund. It is completely restricted unless it is for, again, an encumbered SEP or new CMA cost. Other than that, the department can't utilize that funding in any other capacity.
And in the past, commissioners, like 7 years ago, and years prior to that, we used that as a fund balance to kick off, I believe, the next year's funding mechanism, which we can no longer do.
Correct,
So,
but also with our existing fund balance, which is unrestricted at the $811,000, we have enough to carry us through the first part of the year. But
then
prior,
we're always
yeah.
negative $250,000, so
Yeah.
we utilize that as a funding mechanism for the first 3 months of the year until the returns are coming in.
Yeah. And so now, yeah, absolutely, and now we're at a point where we're not utilizing that funding, so we do keep it fully restricted and we're tracking those dollars so that we're not having to do that up front. Other questions on CMA transition?
No?
Okay. A couple of updates for new items coming down the pipe for DHS. We're working with our web developer, Tricia Coberly and her company, as we are under state legislation. I think it was 211110, Senate bill or House bill, I can't recall, and I apologize, but it was regarding accessibility for clients. And so what we're working on are a couple of things. There are updates to our websites. The first one is a general Q&A option. So we will have on our main website an opportunity for anyone that's requiring a general question and answer. They can now submit that via a form. It'll be a direct entry into our website. It'll send an email to us and we can respond through our call center regarding those Q&As as they come in. We'll also be working on developing a new web page which will house several resources. One listing will be for staff regarding the existing policies and new policies that the department is mandated to meet in regards to a lot of our PICPUF programming, as well as some of our child welfare and our other programs. There will also be a community resource listing there so that should there be any kind of interest in the policies that we follow and how we provide those services, they'll be listed on that website for full accessibility. We are doing it as an add-on web page versus listing them as PDFs, as PDFs are not translatable. And with the new website translator that was added on, all of our web pages can automatically be translated to, I think there's about 70 some different languages on there. So this will allow all of the policies to auto-translate to whatever language the individual accessing our website is doing, so that it makes it more accessible and readily available to them.
So on that, when the conversations for web accessibility began, back as, I think it was 2021, something
Yeah,
like that.
it was in 2021.
Who came up with the objectives and all the, if you will, the rules and regulations to make it accessible? And I would imagine that your contractor is pretty well versed on what the state and the federal government is mandating to be able to meet all those compliances.
So the legislation was actually put in place, and OIT, the Office of Information Technology at the governor's level, was kind of the leading force on developing those guidelines and those specifics so that it was uniform. So our web developer is aware of those mandates and will work with OIT on any updates or information that needs to be modified in order to meet that. But those accessibility guidelines were set with OIT as part of that legislation, so we should be following the same accessibility as the state does for their
So it's
websites.
basically a translation program, willing to communicate with each other in any language?
Yeah, correct. So when you get on our website now, it's all in English, but in the top right corner, it says select your language, and it has a drop-down menu, and like I said, there's 70 some languages. If you click on that language, it auto-translates the entire website, that page that you're on, to that language. And so that's been in place since last year. What we're adding to that is accessibility to contact us, because some folks don't have a phone, some folks may only have access to internet in an area. So we're trying to create multiple points of contact available to them to get a hold of us, so that we can then take those questions in and answer those questions as needed and get them to the right folks within the department. And then as far as the policies, there are several, so for instance, last year we had to adopt a civil rights complaint plan. And so if there's a civil rights violation on behalf of the department, we have to have a form that's available for us to then take that complaint in and research it and investigate it and appropriately address it. We're also moving to having those forms not as a fillable PDF or something that has to be printed because it's not necessarily accessible to all, not everyone has a printer. So the forms will be an online-based form that they can fill out, submit to us, and it will go directly to my email and one backup, which will be one of our deputy directors, to address those concerns should they come in. We'll also have a fillable form on there for our fraud investigation, so if only somebody wants to report fraud anonymously, they can fill that form out. It does not require them to put their information, but then we can follow up on those fraud alerts that we receive.
So I guess I'm going out with that political. Do any of these folks that do not speak English and are applying for benefits through this program have to be citizens of the United States, or is this for anybody? Because it seems to me that we're just opening our floodgates along with our borders to everybody and anybody so they can have benefits for this being in our country. And here we I'm getting off on tangent. You share our point? Is there any criteria? Maybe that's the best question.
I will.
Where they need to be positioned before receiving benefits.
I will divert to our economic security when Ms. Garrison comes up, but there are federal rules and mandates that we must meet, and we're talking about cash assistance programs specifically. Now, in relation to child welfare or adult protective services, we investigate those concerns regardless of nationality or status. We do have to treat every single individual situation if there's an at-risk factor to make sure and ensure that the safety and that we risk mitigate for that family. But in regards to cash programming, yes, there are mandates, and I'll let Ms. Garrison address those more specifically.
Thank you.
One of the conversations that we had through CCI with all this web accessibility, were there any costs covered by the state? Because I like to know statewide what that unfunded mandate, although we needed to make our web sites accessible, but at the end of the day, that became a huge unfunded mandate because 64 counties having to meet that.
Correct.
What was the cost of the San Luis County?
Well, if we look back at the original web development process, and the way the state looks at it is that we draw down between 80 and 90%, depending on the type of programming that we provide. That's the state's investment in that process. I'd have to go pull the invoice to look at what that original web, but again, we were talking about 20% of the total cost was at the county level to institute that process, so we did receive some. And from time to time, it's rare, but the state does have funding that we can try to access if there's grants available. But again, regarding web development, it's rare that we see those types of grants come down, and this is really a mandate that I think my concern for small and medium-sized counties outside of ours that we can't meet that mandate right now is a lot of our small counties still don't have DHS websites. I mean, it wasn't until 4 years ago that we had a comprehensive website for this department to show what we provide as services to the community. And so I do feel like there's going to be an unrealistic mandate for small counties and some medium-sized that aren't in the capacity to do so. I'm trying to get ahead of the game because I guarantee this mandate will be there. And so the earlier we have it, the less work we have to do on that end, because we're also oftentimes by the state given very short timelines to meet those demands. So that's the realistic aspect.
Perhaps hip hop through their fund balance could assist, because this is a real expenditure for our county.
It is, it absolutely is, and I think one of the things, and it's public knowledge, but I think one of the things that spurred us as an agency, and we specifically to move on this faster, is that HICCUP is currently under a very public lawsuit from the Department of Justice regarding accessibility. They are currently, my understanding, in the response timeframe regarding their lack of accessibility for long-term care service determination for at-risk and those with disabilities. And so that lawsuit is pending. And so my thought is accessibility, we need to be in front of that. And the reality is that with the changing world and everything being as technologically driven, we do need to be on, the forefront of that. But ultimately, yes, it is a mandate by the county. But the way I also look at it is it provides the county residents more accessibility to our services. So they're paying for what they're
No, I
paying.
think the benefits are purely tangible.
Yeah.
So for a proposition, so thank you.
Additional to that, just an update, Ms. Eklund and her team, Child Support Services is required to submit an annual plan regarding the child support service programming. They've completed that program, we're just waiting response from the state on the approval at this time. And then I do need to follow up with Finance Director Coberly regarding the cost allocation plan. That is an annual process that we have to go through, and so we need to follow up as we'll be going into audit season to find out where we're at with that.
Cost allocation regarding your mill levy?
No, the county cost-wide allocation that's received, yeah. So that funding goes back to the county, and there's a plan that's required by statute in order to identify how the county utilizes that funding. So that is due to the state on a fiscal annual
Now
basis.
in March, right?
Correct. So it'll need to be completed by March, and then we'll need to make sure that plan's in place for July 1, excuse me. But then that's all I have to report. This board has additional questions.
I have a question.
Thank you for that report. We're going to go to section 4 of the business, consideration of caseload counts and activities by program. Back to you, Mr. Urban.
Commissioners, I'll ask Ms. Ringo to step up for Adult and Aging Services.
Good morning, Commissioners, or good afternoon,
Good afternoon, in this
Commissioners. The
case.
day's flying by, what can I say? Today, I just wanted to talk a little bit about complex cases and some of the barriers that we see in our day-to-day functions. First of all, we're involved right now with a woman who was failure to thrive. She had medical as well as mental health concerns. She was found weighing only 70 pounds. We were able to get her hospitalized, work to get her into a nursing home, and now we have moved her to a lesser restrictive setting in assisted living. But in working with this woman, we always find that there's barriers to the work that we do. To get somebody into a nursing home, we have to obtain a Medicaid application. Our clients aren't always able to do that for themselves. And of course, if any of you have looked at an application, that's a complex document in itself. Then we go ahead and we do a single entry plan assessment for nursing home placement. Once we determine that they are functionally and financially eligible for a nursing home placement, we have to do a PASAR, which is a pre-admission screening resident review process, so that anybody who has a mental health condition or an intellectual developmental disability or is on meds for any of that is looked at to make sure that any facility that they go into is able to care for them properly. And that process can take 1 to 7 days in itself. So when we're looking at Medicaid apps, we're looking at SEP assessments. We have two working days if they're in the hospital to do a SEP assessment. If we're looking at the determination of financial eligibility, they have 45 days. Then we do PASAR at 7 days. It can be very time-consuming to get people where they need to go. And this woman, in moving her to a assisted living, again, we had to start the process. And luckily it didn't take as long, but we have to change her certification from nursing home to HCBS and get her into a facility and get all the paperwork and let the facility know how much out of her income she has to pay towards her cost of care. So luckily with that situation, she's doing much better. She's a woman who I didn't think was going to live, but now she's walking and talking, and I really attribute that to her APS worker, Kathleen Woodring. So I'm really appreciative of her work efforts. We had another woman who we tried through APS to care for in her home who needed a lot of care. We spent a lot of money, thank you, Michael, while we're trying to get her into a facility. We're having issues because she needs an income trust. And it came to the point where we can no longer keep her in her home. We ended up having to have her hospitalized, and I know the hospital was not happy with us work took what we would have hoped would have been done within a week, probably 2.5 weeks. And I know that doesn't always make the hospital happy because we realize they're running a business, they've got to meet their bottom line, but they need their patients to be transferred when insurance no longer pays. So luckily we've got that lady in a facility and we're still waiting on Medicaid eligibility for her. We have another situation that illustrates a barrier. We have a son living with his mom in a home. The son had a stroke and has paralysis. He was in a nursing home. He was not happy there. He left AMA to return home with his elderly mom who cannot take care of herself. He was not on any type of long-term care services and is now refusing to go to a nursing home. Our agencies such as Alta Vista, Caring Angels, or COG are not able to provide the services that this man needs because it's skilled care. We have in-home support services in there, but you need to be able to bring your caregivers to these agencies. And this particular couple really doesn't know anybody in the community. They wouldn't be a good candidate for CDAS because they wouldn't have anybody who could manage their care for them or help them hire. And we've tried in-home support services, but now People Care is bowing out because they're not able to provide employees. And nursing, they will not go to the nursing home and they're competent. So we're trying to figure out how to take care of two severely impaired individuals in their own homes. So that's one of my caseworkers' nightmares right now. She also has another nightmare with the situation where a man had a stroke. He was in a nursing home. He was displaying a lot of behavior concerns, wasn't happy there. He checked himself out AMA. I'm sure the staff were happy that he left. But he has been blackballed by every nursing home in Colorado. And we're unable, excuse me, to get him back into a nursing home placement. I think we've called 60 nursing homes. And it's literally impossible to get him into a nursing home. We're trying to help him with home and community-based care services, but it really isn't the appropriate level of care for him. He needs more care, skilled care, a higher level amount of care. So I feel like with Single Entry Point, we're encountering more of these cases as well as adult protection. We call them complex cases, and we're also finding that we encounter barriers with things such as getting assessments done, getting financial eligibility determined. I know they help us as quickly as they can once they have all the verifications that they need, and then dealing with past SARS. So I just wanted to bring that to your attention, and I'm here for any other questions that you might have. We have a lot going on in our unit right now, as you can see with the transitions with the CCB joining our agency.
I don't have a question, just a comment, pass on to your staff. Sometimes when you have a hard case, or at least what you're describing, I would call it stubbornness or self-inflicted wounds for some of these folks, and I get it at that age. I'd be very particular myself too where I was going to go. And probably very grumpy and grouchy at that time. But please pass on to them. We appreciate what they do and for assisting, because we're all going to be there someday, and all of us are going to handle it differently. And I'm probably going to be the biggest pain for my kids and my community. But please pass on a big sincere thank you to them for what they do to help our elderly.
They would appreciate it because they really struggle sometimes, and unfortunately, we don't always have the answers as leadership. So,
Patience.
Yes, yes, and prayers, yes.
They'll be second to this cranky old home then.
Yes.
I got about 10 years on you, but.
I do think it's a valid point to make, though. I mean, we talk a lot about high acuity concerns in child welfare, and the reality is we have just as much of a high acuity concern in the adult world as well. And not always stubbornness, but oftentimes just the process alone. I mean, I spend, I would say, 75% of my day mediating between economic security and finding them financially eligible, and Lori's team to find them functionally eligible, and that becomes a very trying thing because We have clients that have been told by area agencies, oh, well, you can get on this long-term care program, and then we run the financial eligibility and deem that they're not capable of being on a Medicaid waiver service like that. And so it sets us back to point zero to figure out how to assist these folks when we as an agency don't have the ability to provide that level of care or even get them into that level of care. And so we face just as many high acuity challenges in adult services as we do in child welfare, and so it's a realistic aspect of what we live in. And it's not as easy a fix in either of those programs. So, you know, we appreciate the community members who step up, the care agencies that step up to help us out in those situations, and sometimes it's just kind of putting a Band-Aid on something that needs a tourniquet, but at the end of the day, the team somehow gets it figured out and fixed as best we can. And then unfortunately with adults, there are cases that we just have to walk away from because that individual does not want our assistance, they don't want our services. And so that's their choice.
I'm curious, being an egg producer and very independent, do you see some of those individuals when they come in that are probably the most belligerent? I'm asking that honestly, because I know a lot of individuals that live out in the Kim area that they would not thrive in that kind of environment. I know I'm probably going to be that way.
Yes, we do see some of that, and sometimes we can win them over, and especially too, sometimes individuals see what they're doing to their families, and I miss the days where individuals would listen to their primary care physicians. When I started, it was always the doctor would say, okay, it's time, you have to go to the nursing home, and they would resign themselves to the fact that it was time. The nursing homes would take everybody unless they didn't have a bed, and those were good days. But yeah, there are a lot of people who want to be in their own homes and die in their homes, and for the most part, we can assist with that through our in-home services. But there comes a time where it's just not safe to have that person, and you worry in the rural areas, is there caregivers that are going to go in and help them? So.
And I
It's
think
hard.
what folks also fail to realize is the geographical aspect of this county and the accessibility for a lot of our clients that we do try to serve. Because when you're talking about Kim, that's a good 2-hour drive out and 2-hour back in sometimes. And so with caseworkers going out there to provide that level of service, it is difficult when there's no reception. And oftentimes we'll also find clients do want services, but we've also run across families being opposed to those types of services being put in place. So we find opposition on every level possible sometimes. But I will say this for the team, they do an amazing job daily and are able to get our clients both in adult protective services and in single entry point services to a point where they are able to thrive, and that's our role. And so I have to give them due credit because they do an amazing job to do that. And I watch it every day. So.
You don't realize there are as many as there are out there. But when we got the Care and Share Food Project finally out there in the Kim area, we had 72 individuals, families taking part in that. And there's a need.
There is a need, and I think the other thing that people, and I guess I get on my soapbox with this, but when we talk about accessibility, in the Kim area and some of the canyons, we have folks that still don't have telephones in their homes. We have folks who don't have internet, they don't have, and the reality is that the state we're talking about telehealth and mental health services through the telephone and online. And these folks don't have that type of access. Some of these folks still drive to town and make a phone call once a week. And so I don't think that there's a real understanding at that level either of the impacts that my team goes through daily in order to meet the needs of those clients. And so it's a realistic aspect. We're a frontier county for a reason. We're not even just rural, we're still frontier because of that. And geographically in this type of weather, it's difficult for our caseworkers, but they do it, they get out there to meet with clients. And also takes the right staff and the right leadership to make sure that those clients feel that their caseworkers there for them and that they're doing what they need to for them.
Well, the Denver legislators don't understand that there's people that live in those canyons that don't even have Obviously.
Yeah.
Of course, because they're wanting to, make our program more electronic, that we go out and have them sign the computer, that they access forms, or that they, we connect through like telehealth type channels and that, and that's not
Well, the
workable
three
in
of
this
us,
rural
the
area.
three of us have argued for those frontier people out there.
Thank you.
Because they don't understand that one size doesn't fit all. What's good for the Boulder people isn't good for people that live in the canyons in Colorado.
And it is interesting though, because even some of the surrounding metropolitan areas like Boulder and that will also come back with what fits them or doesn't fit us. Each county is so unique and different that it really requires a very diverse approach to how we do what we do. And so some of even the larger metropolitan areas don't feel that the programming is meeting their community needs either. And so it's a statewide systemic issue in that regard, regarding what is being put through legislation and what impact it has on each county.
And I have to add to that too, that one thing that we argued for that we do have that I'm very thankful for is in the SEC contract, there is rural travel add-on for transportation. They realize that we could be driving 2 hours and they have to compensate us for that. It's not like driving just across Arapahoe County or something. We may, and of course they'll argue they get stuck in traffic, but you know, it's always a debate with the urban counties.
Thank you to all of you. That those complex cases, stories, and testimonials are what we need to bring to our community. Anytime we have an opportunity to share that, especially when you have someone from the Denver metro area. We had a legislative tour late last spring. You know, we had senators from Boulder, Denver. I mean, they came and we walked with them that day, and at the end of the day, they had a debrief and they said, "Oh wow, we basically have no idea." This town is pretty large,
Right.
and the challenges and the complexity of it is the same. The sentiment personally from me to all of you is thank you for what you do, because those communities need us. And then as we are, I don't know, what's the average age for Los Angeles County, do we know?
64.
64. And in the grant app that we did last year, I ran those numbers, and within the next 10 years, right now, our aging population is around 10%. And if I recall off the top of my head, within 10 years, it's going to be, it's going to increase by 14 additional %. So we're going to have folks that are at or above the age to create an at-risk factor for them if they don't have the availability of support from family and resources. We have a very large aging population in Los Angeles County, and it's going to impact these programs specifically, but across the board, service agencies like COG, Caring Angels, Alta Vista, those folks, their workforce is going to almost have to double to keep up with the demand for those types of services.
All of us baby boomers are getting old.
Yes, we are. Thank you so much, Commissioners. Thank you for everything that you do to support us. And I hope you don't mind, but I'm going to leave the meeting because I've got to go jump on another training. So thank you.
Thank you, Mrs. Ringo.
Thank you, Lori. Next, Ms. Eklund, Child Support Services.
Afternoon. I don't have a whole lot to report. I'm starting new year. I'm going to start from the top of the program. And so I'm going to talk a little bit about intake and our applications and different kinds of cases that we have. So we have 4 different types of cases, and those are referrals that come in from TANF, which is the eligibility. And then we have the foster care, our 4A cases, which come from Child Protective Services. We have our non-public assistant cases. Those are just from the public that come in and put in an application. And then our interstate cases, which come in from other states. By the way, at one of our last meetings, we talked about interstate cases, and you asked how many cases we were involved with. I estimated about 30, there's 24. So each, we don't have any application fees anymore. We are federally mandated to have a fee, but the state pays the fee, it's 10 cents. So nobody has to pay for an application. We have 20 days from the date of application to put those cases up in our system. The application date is the date that we receive the application. So 20 days from that date for a non-TANF case or a non-public assistant case, or the date that the application is referred to us from either TANF or foster care, or the application date that we get from another state. Let's see here. Our TANF cases and both the TANF cases and the 4E cases they can have good cause. The TANF cases are required to cooperate with the child support in order to continue to get their grant, but the economic security can give them good cause. If they get good cause from economic security, then they don't have to cooperate with this. As far as the child support, the child protective services, they now will assess the case, and if they feel that the referral is appropriate, they'll refer it to us. So they don't have to be referred to us anymore. And that's as of June of 2023. And then they review those cases every 6 months to see if it's still appropriate, if they do refer it to us. Any questions?
I don't have any, but I do have a comment. On a personal note, I have received information from your office, so I thank you for doing your due diligence. If I'm getting it, everyone else in the community is receiving their paperwork, because I have a young daughter that's, as you know, 3 years with your program, so thank you for that. I just opened the mail today, and there was, so I wanted to see her today. I want to say thank you for being so diligent from your department.
Thank you, Mr. President.
I do know we removed the Division of Youth and Family Services for case count cover. I don't know if Ms. Tucker, do you have anything to update on or?
Just a couple.
Okay.
Yeah.
Good afternoon.
We're used to the morning time.
Yeah. I know, blame you. So just a few things that I was going to talk about today. One of the things that our unit is participating right now is a 4A federal audit. So Callis and Davison and Deputy Director Bertolino have been putting together the paperwork for that. We have a sample size of 14 children who were in custody of the department and in a paid placement between October of 2022 and March 31st of 2023. What they're checking for is to make sure that we did all of the paperwork required for 4E eligibility, that all of the homes were licensed and had all of the paperwork required, again, through the 4E program. I'm kind of looking forward to the results. I'm looking forward to, audit season and using it as a learning opportunity and an opportunity for growth with my unit as we move forward. Another thing that is impacting our unit that's new is House Bill 23-1027, which is the quality family time. We are no longer calling it supervised visitation, it is now family time. We are required to ask the family for informal supports to supervise visitation. Do those visits in the community or in a family member's home, if at all possible. We are also required to have a visitation plan ready to go at the first court hearing for the family, and no later than 30 days after we get custody of children. So a lot of times that's an issue that has kind of a lag between when we take custody and when visits start to occur, and the quicker that you can engage families, the better the outcomes are. So I'm kind of excited about that new Senate bill and improving, challenging my staff to improve visitation between kids and their parents.
So are the courts adopting that terminology as well in that?
Oh, yeah.
So to me, that's going to be really a really better term instead of calling it supervised visits and making the individual parent or parents feel inadequate or not good parents. So I think it's more better to reintegrate children using different terminology and language. So I think that's a good thing.
Yeah, it's also a lot less pressure when you keep it informal and, use family supports as much as possible, because a lot of times families think we're spying on them and judging them during family time instead of actually enjoying that family time. And then today, for example, I was reviewing a case report or a court report with one of my caseworkers, and she was talking about family time, trying to make changes to family time, so we pulled out that House bill, and I said, this is the language that Pam is looking for. Let's do this.
I liked it.
Did you like it? Good. And then another thing, we also have Senate Bill 23039, which requires that the Department of Corrections starts to manage family time with prisoners better. They are required to have a policy and a person appointed to facilitate visits between prisoners and their children. So we've had the mandate that we are supposed to involve incarcerated parents as much as possible and provide them services. However, usually our barrier is the Department of Corrections and them wanting to participate and allow that. So now they're going to be required to do that. So that's something that we're going to incorporate as well.
I know you're new, but in the past, Michael, maybe you can answer this. How have we accomplished that at our county jail level? Or have we?
We have in the past, as far as the county jail, we really haven't had a lot of barriers per se. I think it's more case by case sometimes. We do find once in a while accessibility due to staffing issues tends to be a problem. But just as much as we would find a barrier there, we found other barriers in other facilities around the state. We have folks that are incarcerated in Lyman or, Canyon City, and so there's always some kind of barrier that's been in place there in trying to get those types of meetings set up. I think part of our main barrier in the past has been actually getting communication through the DOC to those parents to ensure that they know that we're trying to make contact with them and to ensure that we're trying to engage them. Because as Jamie indicated, it's always been a standing mandate of child welfare to communicate with all interested parties that are parents in any capacity. But I think primarily here, the main issue is the staffing and having enough support to actually host those types of, because again, we have to put a plan in place. If we can't meet the mandates of that plan, then we're having to adjust, which takes extra time out of caseworkers, out of case aides, and out of these folks, because we transport those folks to and from those kiddos to and from those facilities. And so it's kind of a hardship when we've driven all the way to Lyman for a visitation and we get there and they're not able to see that kiddo that day, so we've driven all that way and back with no result.
Yeah, and they took at the mental aspect of it for the youth, for the children, especially at the local level when they're incarcerated in the county jail. That initial separation is a shock, but you mentioned earlier on the other bill that there's a time frame put in place so they get those visits immediately now, but that's not for, that's just for everybody else. What about the incarcerated folks? Do we implement that here through our department so that that youth child does not develop that mental insecurities, or those insecurities that becomes a mental crisis for them as they become a younger adult or a teenager and because then we got a systematic problem of drug and alcohol abuse and stuff because of the traumatic things that they've had with the children being separated from their parents because of some issue. So if we could, with following that deal, that bill, 23039, regarding the Department of Justice and I'm sorry, the National Justice through the State Corrections, maybe implement that in our local county jail as well to make sure that that connection is there for those children.
I'll lean to legal counsel Nelson if there's been other barriers that I'm unaware of with local, but
that happens all the time. We got a young mom gets in trouble, there goes the kids, and then she's in the hero with dad, vice versa, Nelson, the kids for a month.
well, and I think even, but I think there's even a deeper piece too that we have to start addressing with folks that are in there. I mean, folks are in there because they're not necessarily at their best at that moment. We also need to start addressing the trauma at the parental level as a department too, because ultimately our success in returning kiddos home is not just addressing the needs of the child, but addressing the needs of the parents. And, you know, coming from an RTC world, residential treatment center, that when kiddos are in crisis, they're not making the best decisions at that moment because there's trauma. And so these parents are also traumatized, and they're using and they're doing whatever they are because of that trauma. And so as a department, we have a responsibility to assist in trying to address the needs and address the trauma of the parents. Otherwise, our efforts are futile in getting kiddos returned. Yeah.
With the local facility here, one of our issues is space. Priority goes to attorneys visiting their clients, and I know that that's given us a hiccup in the past, scheduling a visit, and then there was not rooms available. We've done a lot of virtual visits that way. You also have to consider the age of the child, and if that's an appropriate place for them to have the visits. There's a lot that goes into it. But I think our main barrier here is enough rooms to have the visits that are taking place in the jail.
Okay, and then just the last issue is my current open position, so we're currently looking for a lead worker, caseworker, and casing. And hopefully I can start interviews February 1st. I'm kind of waiting for some better applications to come through, fingers crossed.
So one last question for you. How is your new role being, how are you adapting to it and feel taking your place?
We love it. I don't know about her, but we all love it.
We welcomed you last time you were here, but how's the transition been for you?
So far it's good. It's, getting reoriented. Like today I was having a conversation with one of my caseworkers and I really wanted to say fax, which is our computer system in New Mexico as opposed to Trails. And when I was there, I always wanted to say Trails. So just trying to remember the lingo and where I'm at. Another thing that's been kind of a barrier for making really good progress has been the holidays. So the holidays, time off, the snowstorms. So now this week was our last holiday for a while. So we'll have full weeks. We can get people refocused and get to moving our cases forward.
In 10 years, you'll be saying, when's our next holiday?
Exactly.
Come on, commissioners, give us another one.
Yeah. And we found out that I do not have to go through the whole recertification process. So excited about that because I was within the 4 years since I left Colorado. So I'm excited about that. That frees up a lot of time.
You don't want to spike too much now, right?
Well, I like Spike. They were good guys down there. But yeah.
Okay. Thank you.
And finally, we have economic security, Ms. Garrison.
Did you change the name to economic security?
We did last year sometime.
Yeah, last year. I'm sorry, I don't remember reading.
Income maintenance.
Income maintenance.
Eligibility. The state's terminology changed so often.
We don't.
And yet you remain the same. You're like a true north.
We do the same thing over and over, it
Right.
doesn't change. But for your question, you have to have a social security number to get benefits. However, think about this, they're coming here, procreation, those children are eligible because they are citizens. So they're not coming and getting on our benefits like everybody assumes, and I see on Facebook that they're coming and getting our food stamps. That's not the case.
You have to have social security, but if their children are born here, then
The
they have to get
children,
it.
the children are eligible, the women are eligible for pregnancy. We'll pay for them to have that baby, but once that baby's born, they're no longer eligible. If there's a life or limb situation, they lose a leg or a hand or something, we can provide medical for them, but that's it. So they don't. And it's really sad that we're at that point, but we can't take care of ourselves.
You can't pay for it.
Mhm.
I mean, we're only allocated so much money.
And then just a little bit for you. We had this conversation when I talked a little bit about long-term care, and you made the statement, so I need to start moving things 5 years prior to. You better start thinking about that. You can't have your cattle, you can't have your horses. work hard all their lives. They were taught to put their money away. They were taught to save for a rainy day. But yet, when they get to the point to where they actually need our help, they don't qualify because of those resources.
Yeah, it's a very sharp double-edged sword that swings both ways, and it's unfortunate because we do often find folks coming in, so our referral process always starts with economic security before we move to long-term care. So there's two assessments that are done. There's an economic security application, which is assessment one, basically to identify eligibility on the financial level. If they pass that, then we look at functional, meaning that medical provider has to give us a detailed assessment of the medical needs, and then our caseworkers go out and do an assessment of the client's needs in the whole. Oftentimes our main barrier for getting folks on long-term care is financial eligibility. We find that they're not financially eligible because of multiple resources. And the state mandate is that anything 5 years or newer is not within the fair consideration timeframe. And so what ends up happening is they have to go through a period of ineligibility where they have to pay out of pocket for those types of services. And again, it's a hard place to be because some of these folks only have enough resources and savings and property values to maintain a couple of months, and so then they're going months and months without any kind of service in the home until they're then found eligible. There are some who, when we find out they have these resources, just pull their application and say, I'll figure it out on my own, and that's unfortunate as well, because as an agency, we can't provide that level of service to folks who have paid in taxes for us to provide those levels of care, and we can't. This team goes through as much heartache with financial eligibility as our sub-team goes through with functional eligibility for long-term care. So these guys they see a lot of it too.
That comment that I made it jokingly, but 34 out of 1,000 now, agriculture is #1 in suicide and mental health problems. And the average statewide is 20%, so 20 out of 1,000. And yeah, it's concerning.
It is.
Yeah.
It's sad. It's actually sad to say that, like I said, you have to get rid of everything you own in order to get help, which is not.
Or have a good attorney through building a family trust where you don't have any control over it anymore. But then you have to trust your attorney or your children or whoever your heirs may be to make sure that it's just sad. You can't even live on your own land anymore after you work your life for it. So, well.
And we have, like we said, we have those people that refuse to leave their homes because they worked hard for that home. They don't want to leave their home. They want to live and die in their own home. And that's the sad part. Is, most of them can't. They reach a point where they can't. They're no longer mobile. They need people to change their bedding. They need to feed people to feed them. And those are people that have that in the back of their mind.
And I think another piece to keep in mind, commissioners, is that post services, when somebody passes away on long-term care, then the family it's not just an end piece of that case, then there's also the state reclamation office that kicks in. And the state will look at recouping as much on the Medicaid dollar as possible. And so if there was a home or a property exempted or whatever, then the state looks at starting to collect against that and put a lien on the property until that amount is paid. So I mean, it's just, and those are things that we have to discuss with clients up front in order to ensure that they understand the full parameters of what they're requesting us as an agency to do.
Is that second to the death tax, so the inheritance tax? That's second to it, so there's nothing left after they pay for inheritance tax, and then, wow.
If they owe any money back to Medicare, it comes off their assets. Or they have to pay it back when they lose their assets.
Yeah, they can't have my pizza.
There may be many things he's willing to give up, but those are not too.
So we don't take that from you. But the sad thing is, there's interfaces that we use every day that even if they don't report to us that they have things, those interfaces find that stuff. And so it's even harder making them understand, yes, you do not report this to us, however, we have to use this. And it's heartbreaking to make them understand. It is, it's really sad. So,
And if you bury it in your backyard in coffee cans, your memory will forget where it's
Where
at.
it's at, and then it stays in
Right.
until somebody buys your property.
So I would imagine you have, I mean, this is such a process where the family comes together and you have a round table with them so they can understand all the ins and outs and the challenges long term. I mean, the immediate need is we need care for A, right? But then the long term is gonna be, these are basically, this is your true north, a white paper with all the what ifs. And
But the sad part is, we have children that say, that's our money. It's our money. No, it's not their money. It should be first for the parents, take care of the parents first. Then if there's anything left, then it would be your money. And that's the hard part too, is getting the family to understand. You take care of your parents first, use their money for them, if there's anything left over. There are those people.
Here's a dumb question, and I just passed this over to Pam.
There's never in this realm of our
Yeah.
answer.
So, when did DHS really get engaged? In the 60s, the 70s, the 80s?
So as far back as, and I leaned to Bob on this one as our deputy director, but I believe the social services, it was actually welfare at the time, was instituted in Los Angeles County in the late 40s, is when the first round of services came out. Social services, as the department we kind of know it today, really took hold in the mid to late 50s. So there were welfare programs that were in place kind of in between that time frame. The current level of DHS kind of came around in the 80s, kind of when APS started being added to and those components.
So the reason I'm asking is like the child protection side of it, when did that?
Actually, the ASBCA, so there was animal welfare before there was child welfare. So child
Yes.
welfare started around the beginning of the 19th century, around the 1900s. And they didn't really have social service organizations until probably about the Great Depression. And then they had orphanages and stuff like that.
wow.
And then on a better note, we do have blankets available for the homeless in case you guys hear of anybody or know of anybody that needs blankets. We do have blankets available. We are actually purchasing more blankets through the LEAP program, so we do have those available. One of the sheriff officers that was sitting as security the other day said we used to carry those around in our vehicles, and we just haven't had the funding to carry them anymore, so they are available if anybody knows of anybody that needs any. I felt bad this weekend, I felt like I wanted to stand out there and hand them out, but, they're available. We're trying to help.
Is there a criteria that you need to meet to, or just come in and ask at the office?
Just come in and ask.
Yeah, and they're not exclusive to homeless, we know there are families who need blankets as well. We felt as outside of spending money on swag that really just gets handed out and, and that gets thrown into a bucket somewhere, we'd rather purchase something that we can, one, promote the program, but obviously have some impact in the community. And so after several years with Ms. Garrison, we were able to look at purchasing some blankets, and so those are available to anyone within the community as long as supplies last. So
Maybe to get the word out a little better is reach out to the churches and to Reverend Bruce.
Pastor
Clay.
Clay he came and picked up a box.
And then also, I'm gonna reach out to Marcy Key to keep Trinidad safe.
Yes.
Side with the church too, they have
Yeah.
knitted blankets. So Joni Jones makes knitted blankets, one of them.
And then for those that are not, or live in their own homes, remember our new program is going until April, so if anybody needs their, propane or their wood.
No, double dust our income guidance.
That does have income tax, however, but the applications went out to everybody prior to, the actual start of week that had applied last year, but we do have applications at the department, so if you know of anybody,
Okay.
we have applications at the department.
applications are also available at COG. I believe they put them at the senior center, and then the city of Trinidad also has. the
We dropped
application
off some
center.
applications on Tuesday.
Does the court still implement some, useful public service? Yeah, they used to, instead of you, if you got found guilty in court in our district and county courts locally, that instead of having to do public service, you could provide firewood for the indigents. Is that program still in place?
Yes, Ms. Lopez did reach out to our department to let us know, because she does have clients or people that need to do their,
Useful public service?
yeah, public service, so we do have, and if we know of anybody that comes in to tell us we need wood, we are able to refer them to her, and she is able to get them, she will be able to get them out to do, get some wood to the people. And then I'm not done yet. I want to introduce one of my workers. Her name is Susan Wolfram. She is my workforce development coordinator that is housed at the workforce center. And she's going to give you a little spill on what she does for, not only for our program, but for child support as well.
Thank you. Thank you. Welcome, Susan.
Good afternoon. My name is Susan Wolfram, and I've got a little thing for what basically I do. It says, "Welcome to Colorado Works. There is so much more to the program than cash assistance. Together we walk the path to help improve the family's well-being. Once the application is received, the client can expect they will first have the initial interview with an eligibility worker to determine their eligibility at DHS. The amount that they will receive each month depends on the size of their household and their income. Then they will meet with me, their case manager, who will help them develop an individualized plan, an IP. The IP includes other assistance to meet their family's basic needs, like housing costs, childcare, and transportation, as well as services and support surrounding safety planning, counseling, recovery, physical, mental health, life, and communication skills. They have access to education and career development, trainings and certifications, money management services, legal assistance, recreational and cultural experiences. Once they have their IP, they will meet with me regularly, making sure everything is on track. During these meetings, we will provide all the paperwork needed to ensure that they reach their goals. They will be required to communicate with me if they have any changes in their situation or they are experiencing any challenges. If they fail to comply with the conditions, they will enter a period of non-compliance, and I will start a re-engagement progress. If they fail to re-engage, they will enter into a sanction process where a percentage of their grant will be taken unless they request good cause. If they continue to fail the engagement process, they can lose their whole grant and they will have to comply before the reapplication process can happen. I will coordinate with their supported payments if needed and refer them to other resources they may need. All payments are done through electronics benefits transfer, the EBT card or direct deposit. Every 6 months, then they will have to complete their recertification. I will follow up with them to see if they remain eligible for Colorado Works. If they do not continue on Colorado Works, they do not have to continue. Basically, I've been working with the non-custodial parents. I have 9 of them. My clients, we've done everything from one started a GED, one started his own business. They are actually, what I'm trying to provide in them is self-esteem, and I send them an email every Monday of all the jobs at the workforce center and who is particularly hiring. The recent phone calls to the workforce center. So like, let's say Builders is hiring or Club 14 is hiring. I send in an email. Well, I think I bombarded them with emails, and so they're finally responding back to me. I have an interview with Burger King today. I have an interview with Safeway. I had a guy come in the other day, he had an interview with Safeway, and it went real well, so he was all excited. Just trying to reinforce them, get them back in the working field so they can pay their. And I deal directly with the caseworkers, have a spreadsheet, basically send it out weekly, I have court this Thursday. Do you have any questions?
No.
Okay, so you mentioned grant in your statement.
Right, because it's through Colorado Works.
So we consider their funding a grant, and if they don't,
Yes.
if they do not abide by the policy in place, then they have to repay that grant?
They don't have to repay it, now they're gonna be docked for it.
Okay.
So essentially, Commissioner, as you know, last year, the state made an adjustment to the basic cash assistance, which is part of the Colorado TANF funding. So that funding is considered a grant to a client. In the past, and part of why we put this position in place specifically is that although our technicians do a great job of managing the Colorado Works case load, they also have hundreds of other economic security cases that they carry. And so part of the workforce development piece is that they have to meet this IP and they have to maintain that in order to stay on that program up to a maximum of 60 months. Without having that workforce development piece, we were essentially initiating BCA payments every month without any accountability. And so bringing this whole from them was to try and actually get our clients who are on those BCA grant payments through Colorado Works to actually meet the criteria of the program in order to, because the goal is to either give them the education they need to become gainfully employed, or if they have that education and training, to get them back into the workforce now. This is supposed to be a temporary bridge for folks who are, displaced in the workforce. We had seen folks staying on the program 60 months, never actually attaining educational goals, never attaining any kind of secure job, and then requesting diversion payments beyond that 60 months to maintain getting additional payments until it ran out. Essentially, this is an accountability piece, but more importantly, it's to really engage the clients. And so, although she was brought on as a workforce development for TANF, she also does support for our child support and our non-custodial parents who are also displaced in the workforce and trying to get them back in to get caught up on arrears or whatever other payments they need to be making.
And this was implemented through state?
No, this was something that I
Your department?
Good, yeah, myself and Ms. Garrison discussed this multiple times, and there was a position similar to it some time ago, but I don't think it was as robust in that capacity, and realistically, with the increase to the BCA, which will take place over the next 3 years, at a 30% rate increase at the end of that 3 years, we really have to be mindful of the amount of money that both the county is committing, but also that the state TANF funding is committing to these grant payments to our clients. We do have the ability to provide clients with, outside of their normal cash assistance, if they need clothing for an interview, if they need resume paper, she does resume building workshops with the Workforce Center, and that's primarily why we placed her down there. This is also a new model for the state. So when I approached the state office of the workforce development to talk about having this person there, they're looking at how this will function, because our biggest issue is getting our clients from our desk here down there. And so her job is to bridge that gap, because we're sending them out the door and they are supposed to go to the Workforce Center and then they never show up. And so this is our bridge now, and she's.
One of my clients came in,
Yeah.
he was having trouble filling out his social security number. We spent 2 hours, but we completed it. He's gonna actually, someday soon, have an income.
Is there a connection with the college?
Yes, I've met with Nicole Shannon for the GED course, that's how I got my client in there. Janet Hutchison and Donna Hadlow. And then I also deal with Rachel Gonzalez through Catholic Charities. And then if they need a cell phone, I've got a resource list, I give them a cell phone. She comes down, she meets them at the Holy Trinidad Church, we get them a cell phone. We get them anything that they need. I want them to go home and be happy, to get up and say, I'm gonna go to work today, it's gonna rub off on their children, It's gonna rub off their family. They're gonna go to work, they're gonna continue to go to work, and hopefully
That's amazing.
deserve a better life.
Director Aragon, Director Garrison, and all the other directors, thank you for hearing the pleas of the commissioners for accountability for some of this program. And this is exactly what we're talking about, having this person put in place. And hopefully this shows the state that we can show down. If we have 1 out of 10, that's a 10% increase on any placement, job placement. Not only that, circulation of money back in the community instead of a bleed on it. So I'm very happy to hear this today.
They have
seen
a
you before.
purpose.
I wasn't sure what you were.
They have a purpose and they feel better about themselves. And then my experience, I've been in the oil and gas field. I worked for Pioneer for 15 years. I was the senior safety coordinator. And if I can keep 565 employees safe at one time, I can do this.
Do the right person.
Yeah, I love my non-custodial parents. I love them. Sometimes they drive me a little bit crazy, but I do. I really respect them, and they're gonna do it.
Welcome.
And they're gonna do it.
I'm gonna go out on just a comment, and Mr. Eric and I have had this conversation about having some of the employers, maybe a workshop for them. If they're looking for something, an employee that needs X, you work with them, and all they need to do is make a phone call to you and say, you know what, Felix, you're the person that's gonna work with an interview there.
Well, actually, workforce is divided. Like Michelle, she's gonna be career services. Tracy's gonna be business services. Now, she's gonna go out to the businesses and pull in jobs. So with my 2 co-workers, I've got the world in my hands.
And that's part of the reason why we decided, so there are other counties that have workforce development coordinators, but they're housed at DHS. We wanted her right next door to where she could get that information live and know that, I mean, because sometimes we know the reality is getting the interview and getting that job is sometimes seconds, because,
Where it gets more.
yeah. And so as soon as she gets that information, if she has a client that fits that, then she's reaching out to clients. And so that's why we built this model. And other workforce development coordinated, well, other workforce centers are throughout the state, at the state level, are having a conversation about the model that we built here and having this person at the workforce center. And so we're also by mandate, and if you recall, commissioners, I think it was probably about 6 months ago, we brought forth the agreement between us and the workforce centers that there is also specific data regarding our TANF clients that we are supposed to be reporting annually to the workforce centers. That had not been happening, and so now having her there live, we know that we've got that connection to be sure they have the data that they need to drive their services as well. So it's a mutual agreement. We do pay a lease for her office space down there, but it's well worth it, and I think it will come back in tenfold in time. It's a matter of, this program is less than 8 months old, and it'll take some time to get some traction, but I think once it's going, we have a real good opportunity to get folks in Los Angeles County back into the workforce.
Awesome.
There it is. Welcome, Susan.
It's wonderful. It's wonderful putting your face with the name. I've lived here since 2005, but you know how you see the signs? You know, everybody's, you know, I want to elect me, and it's like I've never seen the faces with names. So that was absolutely breathtaking.
Thank you.
Thank you. Commissioners, any additional questions or comments regarding case loads?
Yes, I got one for you.
Yes.
So, in the last 12 months, I was looking at this, the Magi adult, the Magi children, and the family planning are all down significantly, like 1,000 cases on the Magi adults and 400 cases on the Magi children. Why?
She'll answer, but I know why too.
So you remember when we first had everybody apply for medical assistance? You go online and you apply for medical assistance. And you fill out your own application and it's real-time eligibility. Guess what? KG ended. Those people were probably not eligible all along and came off. And that's why you saw such a big decrease in numbers.
Yeah, okay.
So those specific Medicaid cases are what I like to detail them as, or define them as, is your day-to-day medical coverage. So you're going to see your primary care physician, or you're picking up prescriptions, those types of cases, and when the PHE went into effect, it was real time, as she mentioned, so anyone that applied got on and they stayed on. And it was when the PHE ended, as I mentioned before, we would see a significant drop in those. And so, you know, I think we had on that COVID lockdown report a little over 3,800 clients. Now, the majority of those requalified in some capacity or they're no longer here. But there were folks that probably shouldn't have been on there because they didn't qualify. And once the PHE ended, we were able to utilize those resources. That's why we saw those numbers drop.
So I was hoping that it was because times were better, you know.
Sorry, I was thinking about that, that's why I had my numbers with me, but I forgot to mention that. But that's the reality of it, is it happened, people got medical, thank God. They got medical, but now the reality is.
So no wonder the hospitals wanted their money right front and for the program we were talking about earlier.
Well,
For the person that didn't have a placement, and because now they don't have that slush fund, I'm sorry, but that's what it was. It was a slush fund, everybody was covered.
And we did have a meeting with the hospital, and I did indicate that when the PHE ended, the drop in Medicaid would be significant. Because if you really look at the provider rates of return, the hospital only recoups about 20% under Medicaid for the services rendered, so they take a big loss with Medicaid.
When I get an aspirin, they charge me $100. Offset. Cost of doing business, same thing in any business.
Sure.
It's
Sure,
cost of-
sorry.
Any business has, you know, your overhead that you have to cover in order to keep your overhead covered.
Anything else?
Susie, open? Don't give me one down there.
I like it because he keeps asking one.
Thank you.
Thank you, folks.
Thank you, ladies.
Okay, no other questions on that, I'll entertain a motion to approve the consideration of caseload counts in activity right program.
So moved.
Second motion.
Commissioner Luis Lopez?
Yes.
Commissioner Tony Hass?
Yes.
Commissioner Felix Lopez?
Yes, 4B, consideration of state of Colorado contractual agreement case management agency, parentheses, single entry point. The first question I think goes to legal counsel. Any,
I reviewed this monster and there are no legal concerns at this time. I have discussed it and the requirements with Mr. Erica, but as far as legal concerns, I have none.
very good. One of the questions, Mr. Elegant, this is effective, let's see, you're right, it's a master. The effective date and then this particular one will have an expiration date.
Correct. The legal counsel Nelson pointed that out. So commissioners, this contract was, so our former single entry point contract was given an extension during the transition phase. And so that extension was in place until, and I think the effective date, and do you recall what that effective date was?
March 1st.
March 1st.
Yeah, March 1st.
So we have to be fully transitioned by that timeline. This means that within the March 1 to June 30th, the state will expect that all the mandates have been met at that March 1st timeline, and that we're in compliance to continue. In July, we will have to, well, sometime in June, we'll present a new contract to the board for the next fiscal year. And I believe that contract will be a 4-year fiscal year contract as we've had in the past. This is to cover the timeframe of when it drops off until the new fiscal year comes in.
Under Exhibit 1, I'm sorry, Councilman. Supplemental provisions for federal awards, I was reading that last night. And speaking of dates, it says the set award period performance date is 3/1/2024. The end date is 6/30/2031 for the date which your contract ends. So that, our contract ends annually, so this doesn't apply.
Can you tell me what page you're on?
Page 145 of 257 on the packet. Yeah, and I'm sorry I'm bringing that up now. I should have told you earlier.
I think this is a big package, you should have seen the one we had for our general.
Yes.
Well, just keep in mind, this is a bridge contract. When the actual step contract comes down as the CMA, I anticipate it'll be much larger.
So it's exhibit 1, supplemental provision, and then under your,
Yeah,
item
so
number
that
5.
qualifying sentence or the date in which your contract ends, whichever comes sooner,
Okay.
so that
So we're
2024.
good and order. Okay, that's the only question I had.
Okay, having no other questions, I'll entertain a motion.
Move to approve the State of Colorado contractual agreement with Case Management Agency, IKA single entry point.
Second motion.
Commissioner Tony Hass,
Yes.
Commissioner Luis Lopez.
Yes.
Commissioner Felix Lopez.
Yes. 4C, consideration of State of Colorado MOU, Colorado Works Program. Mr. Erica.
So Commissioners, just to identify one point that legal counsel Nelson have pointed out, Colorado Works, the next two contracts were up through the CDHS. This specific contract had a back date as during the transition to move the CCAP TANF-funded child care assistance program out to its own department, which is now under the CDEC umbrella rather than the CDHS umbrella. An extension to those contracts were granted, and so the existing MOU stayed in place as is.
2022, right?
Correct. And so since then, we've been under that extended umbrella, so now this contract is to encompass everything to that back date and moving forward, and so that's why you're gonna see that 2022 date.
Funding was already
Correct.
provided. This is just for the state of the contract.
Correct.
So I can take my highlight on the sentence there. Thank you. It was gonna be a no way 2022, but thank you so much. Council, do you have any other questions on this?
I've reviewed, no concerns, questions.
Thank you, commissioners. Having no other questions, I will entertain a motion.
Motion to approve the state of Colorado MOU, Colorado Works Program.
Second motion.
Commissioner Luis Lopez.
Yes.
Commissioner Tony Hass.
Yes.
Commissioner Felix Lopez.
Yes, for the consideration of State of Colorado Memorandum of Understanding, Colorado Child Care Assistance Program, CCCAP. Mr. Aragon.
So again, Commissioners, this is a contract. Now this one is being made from the date, first date of January 23, between the CDEC and the Board of County Commissioners as Los Angeles County DHS. This is in regards to our child care assistance program as outlined by statute. Are there any questions regarding this contract?
Any issues, Council?
No legal issues.
And this has the right dates.
Yes.
The other ones did as well, it just didn't appear at the beginning.
My eyes are bleeding.
This was a rough month of contracts, and I just want to remind the board, we're going into contract season, so March, April, May will be a rough time for us all, so. Sorry, yeah.
Any other discussion on this particular contract? If none, I'll entertain a motion.
Move to approve the State of Colorado MOU with Colorado Child Care Assistance Program, CCCA.
Second motion?
Commissioner Tony Hass.
Yes.
Commissioner Luis Lopez.
Yes.
Commissioner Felix Lopez.
Yes. We're going to go to section 5, financial matters. 5A, consideration of financials and deals for November 2023, and I think, am I correct, you have requested to present this at a later date?
No,
Okay,
no. Last month, we were updating on the single entry point
very good. Thank you.
funding. That's all been corrected, so these numbers are accurate to
Very good.
the state report.
So let's go back to you, Mr. Carrera.
Commissioners, in front of you are financials for November, ending November 30th, 2023. Are there any questions on the financial summary and or the bills for the month?
Any concerns, Chairman?
No questions, Mr. Carrera. So on that particular, if there are no questions, I'll entertain a motion to approve 5A.
Motion to approve financials and bills for November 2023.
Second motion.
Commissioner Luis Lopez,
Yes.
Commissioner Tony Hess,
Yes.
Commissioner Felix Lopez.
Yes. 5B, consideration of special payroll December 8, 2023. Back to you, Mr. Herrera.
Commissioners, we did a special payroll in regards to an approved bonus for our staff. Our staff sent their appreciation, by the way, for that, so thank you. In front of you is that 12-8 special payroll. The total amount was $76,000 even. Are there any questions?
Questions?
Yeah, it was a pretty hefty packet, my apologies.
Yeah, this is a small.
And how does that allocate? Like percentage wise?
I'm sorry, Commissioner.
It was a flat 1,500.
It was a flat 1,500, but it was also based on the month of employment, so if they were less than 1 year, it was prorated for the number of months they were involved, yeah, with the department.
And that was $76,000.
Thank you to Finance Director Coberly for working the numbers. We're able to do this along with the rest of many of the county employees. Well deserved. Wish it was more.
Any other discussion? Otherwise, I'll entertain a motion.
Move to approve the special payroll December 8th, 2023.
Second?
Commissioner Tony Hass,
Yes.
Commissioner Luis Lopez,
Yes.
Commissioner Felix Lopez.
Yes. 5C, consideration of payroll for pay dates December 15th and December 30th of 2023. Mr. Herrera.
So Commissioners, just to point out on the December 15th payroll, that payroll included personal payout for personal days that were unused during the month, for the annual year. And so the total payroll for 12/15/2023 was $108,354.85. The personal day payout encumbered in that amount was $6,040.63. And then for the December 28th payroll, the total amount was $109,797.51. Are there any questions?
Questions, Commissioners? Okay, if no questions, I'll entertain a motion.
Motion to approve payroll pay dates December 15th and then 30th, 2023.
Second motion, sorry, guys.
Commissioner Luis Lopez?
Yes.
Commissioner Tony Hass?
Yes.
Commissioner Felix Lopez?
Yes. Having no other items on this agenda, unless Director Herrera, you have any closing comments, I'll entertain a motion to adjourn this meeting.
So moved.
Second motion.
Commissioner Tony Hass?
Yes.
Commissioner Luis Lopez?
Yes.
Commissioner Felix Lopez?
Yes.